Cancer. The very word evokes fear, uncertainty, and a sense of helplessness. It's a disease that has plagued humanity for centuries, a silent stalker that can strike anyone, anywhere, at any time. But what exactly is cancer? Why does it occur, and how can we protect ourselves from its clutches? This essay aims to demystify cancer, providing you with a clear and concise understanding of its causes, types, and preventive measures. We'll delve into the intricate workings of this disease, exploring the factors that contribute to its development and the various forms it can take. Our journey will take us from the microscopic level of genes and cells to the broader context of lifestyle choices and environmental influences. We'll unravel the complex interplay of factors that can tip the scales towards malignancy, empowering you with the knowledge to make informed decisions about your health. Remember, while cancer is a formidable foe, it's not an unbeatable one. By understanding this disease, we can take proactive steps to minimize our risk and navigate the path towards a healthier future. At its core, cancer is a disease of uncontrolled cell growth. Our bodies are constantly generating new cells to replace old or damaged ones. This process is tightly regulated by a complex network of genes and proteins. However, sometimes errors creep into this intricate system. These errors, known as mutations, can disrupt the normal life cycle of cells, causing them to multiply uncontrollably and invade surrounding tissues. This uncontrolled growth can lead to the formation of a mass of abnormal cells known as a tumor. But what causes these mutations in the first place? The answer, as with many things in biology, is complex and multifaceted. Cancer is rarely caused by a single factor, but rather by a combination of genetic predispositions and environmental triggers. Let's delve deeper into some of the key culprits behind these cellular transformations. Our genes, the blueprints of our existence, play a crucial role in determining our susceptibility to cancer. Inherited mutations in certain genes can significantly increase the risk of developing specific types of cancer. For instance, mutations in the BRCA1 and BRCA2 genes are linked to an increased risk of breast and ovarian cancers. However, it's important to remember that inheriting a faulty gene doesn't necessarily guarantee you'll develop cancer. It merely increases your susceptibility. Many people with genetic predispositions never develop the disease, while others develop it later in life than they might have otherwise. This is where environmental factors come into play. Our surroundings are awash with potential carcinogens, agents that can damage DNA and increase the risk of mutations. These can include tobacco smoke, a potent cocktail of over 7,000 chemicals, many of which are known carcinogens. Radiation, exposure to high levels of radiation, such as ultraviolet radiation from the sun or medical imaging, can damage DNA. Infections, certain viral and bacterial infections, such as human papillomavirus and Helicobacter pylori, can increase the risk of specific cancers. And lifestyle choices, factors like diet, physical activity, alcohol consumption, and exposure to certain chemicals can all influence cancer risk. It's the complex interplay between our genes and our environment that ultimately determines our individual risk of developing cancer. Cancer is not a single disease, but rather a collection of over 100 different diseases, each characterized by the uncontrolled growth of abnormal cells in a specific part of the body. These cancers are broadly classified based on the type of cell they originate from and their behavior. Carcinomas, the most common type of cancer, arise from epithelial cells, which form the lining of organs and surfaces throughout the body. Examples include lung, breast, colon, and skin cancers. Sarcomas, these cancers originate from connective tissues such as bones, muscles, cartilage, and fat. Lymphomas, cancers that affect the lymphatic system, a crucial part of the immune system that helps fight infections. Leukemias, cancers of the blood-forming tissues, such as bone marrow, that result in the overproduction of abnormal white blood cells. Brain and spinal cord tumors, these cancers can be either malignant or benign and can affect various parts of the central nervous system. Each type of cancer has its own unique set of characteristics, growth patterns, and treatment options. Understanding the different types of cancer is crucial for accurate diagnosis, prognosis, and the development of effective treatment strategies.